In the third section of our lecture, Obstetric History and Examination, let's talk about the pelvic examination. In this section, we will talk about how we can assess the bony pelvis by pelvic examination. Then we will talk about the planes of the pelvis and then outlet of pelvis. The pelvic examination. Pelvic examination during pregnancy is usually, if there is ultrasound is available, pelvic examination or manual pelvic examination is not performed, because manual pelvic examination is can cause exaggerate the or can cause contraction of the uterus, can cause changes in the cervix also. So it's not applicable where ultrasound is available. It's done to find out the size and shape of the pelvis. Size and shape of the pelvis, especially the size, is important to find out if the pregnancy or the delivery can be normal vaginal delivery or its C-section is required at the end, because if the pelvis is small, usually the normal vaginal delivery is not possible. Speculum examination in early pregnancy for assessment of bleeding, for cervical assessment, diagnosis of labor, and to confirm ruptured membrane. Increased in vascularity of paravaginal tissues, vaginal wall becomes purplish. In the early pregnancy, when the vascular changes occur in the cervix, usually the cervix become purplish or reddish. And there is increase in the mucus secretion, increase in mucus plug, and this is the changes in the cervix due to increased vascularity or vascular changes during the pregnancy. Next, assessment of bony pelvis. Pelvis is made up of the pelvic bones. We have 3 bones that makes up the pelvis. We have the ilium, then the ischium. The big bone is the ilium, then the ischium, and then the pubic bone. The 2 pubic bones of both sides form the pubic symphysis. This is the pubic symphysis. So 3 bones, we have the ilium, ischium, and pubis. So ilium, ischium, pubis, they form the bony pelvis. Inlet of the pelvis is bounded by sacral promontories. This is the sacral promontory. On the posterior side, we have the lower part of the vertebrae known as the sacral bones or sacral vertebrae. All these sacral vertebrae, they combine to form a sacrum. So all the 5 sacral bones are combined together. And below the sacrum, there is coccyx. These are the 3 coccygeal bones. So this is the sacrum here, sacrum. All this is the sacrum. So inlet of the true pelvis, inlet is the upper part from where the pelvis start, inlet, and then the outlet is from where the baby is delivered. So outlet is we have the pubic symphysis. This is the pubic symphysis. And this is the inlet is by the sacrum. So this is the sacrum. So inlet of the true pelvis is bounded by sacral promontory. Then pelvic outlet, this is the outlet, is bounded by the pubic ramus. This is the pubic rami, 2 pubic bones in the middle combined together or joined together, known as the pubic rami. Dimensions of the inlet of the true pelvis. What's the dimensions? We have 3 oblique. This is the oblique dimension. This is the anterior posterior AP dimension, and this is the transverse dimension. So 3 dimension. Oblique is 12 centimeter. Transverse is the biggest or largest dimension, which is 13 centimeter, and then we have AP is 11 centimeter. AP is from the sacrum to the pubic ramus. Transverse oblique is between the ilium here and then the pubic ramus or pubic bone, and then this is the transverse between the 2 sides. So the largest diameter of the outlet or inlet of the true pelvis is, this is the we have oblique, AP and transverse, which is the largest diameter. Then inferior pubic rami, this is the inferior pubic rami, should form an angle of 90 degrees. This is the inferior pubic rami here. If we draw the lines across this, it should form 90-degree angle. These are some bony landmarks of the pelvis. 3 bones combine to form the pelvis. We have ilium, ischium, and pubic. Pubic bones of the 2 sides combine together to form the pubic symphysis. This is the pubic symphysis, pubic rami here. This is. So antenatal, clinical, or radiological pelvimetry. Pelvimetry is the study of the pelvic planes or pelvic inlet and outlet. Next, plane of the pelvis. Plane of the first pelvic inlet. AP diameter or anterior-posterior diameter of mid-cavity and pelvic outlet. Pelvic outlet, AP is the least pelvic diameter. Here, this is the least pelvic diameter which forms from the lower part of the symphysis pubis to the sacrum. And this is from the middle part of the pubic symphysis to the sacrum. The greatest pelvic diameter is about 12.75 centimeter. These are the conjugate diameters of pelvic inlet. We have true conjugate, obstetric conjugate, diagonal conjugates, and these are the diameters through which the head of the baby should be delivered. This is the clinical assessment of ischial spine. These are the spines at the plane of least pelvic dimension. So this is the planes of pelvic inlet. Bounded posteriorly, this pelvic inlet, if you see here, this pelvic inlet bounded posteriorly by the sacral promontory. This is the sacral promontory. Laterally by iliopectineal lines, and anteriorly by pubic rami and upper margin of pubic symphysis. So all these are the margins or planes of the pelvic inlet. Posteriorly is the sacrum, inferiorly or anteriorly is the symphysis pubis, laterally is iliopectineal lines. This is the ilium bone, iliopectineal lines. This is the ischial spine. So all these are the planes of the pelvic inlet. Next, planes of the pelvis. We have plane of greatest pelvic dimension. Here you can see this is the plane of greatest pelvic dimension, which goes from the center of the pubic symphysis to the third sacral vertebrae, and then we have plane of least pelvic dimension, which is from the lower part of the symphysis pubis to the lowest part of the sacrum. So this is the plane of greatest pelvic dimension, little clinical significance, and as an anterior, posterior and transverse diameter of 12.7, and then extend from midpoint of pubic symphysis to the junction of second and third piece of the sacrum. This is the great plane of greatest pelvic dimension. So greatest pelvic dimension is from the center of the symphysis pubic to the second and third sacral vertebrae. This is how, and then least dimension, this is the least dimension from the lower part of the symphysis pubis to the lower part of the sacrum. So from the middle part of pubic symphysis to the second and third, that's the most or greatest dimension, which is about 12.7 centimeter of the pelvic. This pelvimetry is very important to find out if the pelvis is big enough for the delivery of the fetus. Outlet of the pelvis. Now you can see this is the outlet of the pelvis. Anteriorly, this is the pubic arch. Posteriorly now is the coccyx. And laterally we have ischial tuberosities and ischial spines. So these are the outlet of pelvic outlet. Outlet of the pelvis consists of two triangular planes. So this is 13 centimeter, we have 12 centimeter and 11 centimeter. So that was all about the bony structures that make up the pelvis. We have the pelvic inlet, pelvic outlet, and what are the different diameters of the pelvis. Thank you for watching sqadia.com.